14 days strike notice, accusing the government of failing to attend to their needs as they continue to fight the deadly coronavirus at the front line. Now, the clinical officers issued a 7-day ultimatum for the government to provide them with PPEs, among other demands. Now, this comes even as another clinical officer in Kisii succumbed to the virus last night.
As COVID-19 continues to claim the lives of frontline health workers in the country, the Kenya Union of Clinical Officers has issued a 14-day strike notice threatening to halt operations in various hospitals across the country if their demands are not met.
It's either we give a notice, we withdraw the services, and then the government can put its priorities in order, or we can look on and pretend nothing is happening, and then you'll see health professionals abandon duty.
All its members and all other healthcare workers of goodwill will go on strike immediately after the lapse of the 14 days.
And we are going to go out because these things that we are mentioning today are not out of space. These are actually bare minimums that we're not supposed to be negotiating about, but the government has pushed us to a situation where we have to keep asking for the basics for us to be able to offer services to Kenyans effectively.
Earlier last week, the union gave a 7-day ultimatum to the government to assure health workers their safety as they continue to control the spread of the virus.
And so we will be demanding that certain measures are put in place within the next 7 days, failure of which we are going to issue a nationwide strike.
According to the union's chairperson, Peterson Washira, a principal clinical officer succumbed to the virus Saturday night in Kisii County, further asking the government to exempt vulnerable health workers from reporting to work.
So it's very unfortunate that today we are starting with a notification of a death of one of us who belongs to the vulnerable category, from which we have been asking the government for the past so many months to be able to exempt from active duty.
Iwapo viongozi wa hii nchi wanaipenda nchi yetu, waweze kuita mkutano na viongozi wa afya, wa wahudumu wa afya, ili tuweze kujadiliana ni jinsi gani yale matatizo yaliyopo na yanayochangia katika vifo, na hasa wale maambukizi ambayo yanaendelea kukua juu, tutaweza kuzuia vipi?
The union also wants the government to provide them with personal protective equipment PPEs, a comprehensive medical cover for health workers, payment of salaries to health workers employed under the Universal Healthcare Program UHC, and the employment of an additional 3,000 clinical officers. Meanwhile, the total number of confirmed COVID-19 cases in the country has risen to 77,372 after 968 people were reported to have contracted the virus in the last 24 hours. 155 more people have recovered, totaling the number of recoveries to 51,507 as 14 others succumbed to the virus. Musa Salah, TV 47.